I decided that I wanted to go back to school actually at that point for interior design, specifically to focus on healthcare design and how it related to the aging population and how we can create communities and societies to support our people as they are aging. And so that led me to interior design and working in healthcare design. And through that process, I just discovered, a lot of different facets within healthcare design that you can specialize in, both in the aging population or, in very medical inside hospital design, but then also maternal, pediatric, infant care. And I started to focus a bit on the pediatric mother-baby care. So that's where I did a lot of my focus early on. It was a beautiful merging of some of the things that I'm very passionate about. And one of them is healthcare, interior design. But the other one is mentorship and actually bringing more awareness to the focus of healthcare design, because I think it's so important. And I think if you have, if you're somebody who likes psychology or social work or have some of that kind of pull for society and want to serve society and your community, that this is a really beautiful way of doing it as a designer, because you're impacting your community, you're impacting other countries if you're fortunate enough to work in other countries, So when I saw that this position was open, I felt like this was a way to really be able to spend some time focusing on that piece of it, where I get to advocate for healthcare interior design, and I get to support the growth of students who are interested in this, who are already interested in this. And it's basically teaching our designers how to do a research-based project. So it's looking at all of the elements of design, but through a research lens, and then looking at the outcomes and using the data, to create measurable outcomes for staff, for healthcare organizations, for patients, for family. The reason that you do it in healthcare, I think, is because the outcomes are so important. We're dealing with a lot of money, and we're dealing with people's lives. And, those things deserve a lot of attention, and research behind it. Common misconceptions, I think, is that healthcare design is boring or sterile. And it couldn't be farther from the truth. Healthcare design is complex. It is, like I said earlier, community focused. It is about people. It is about experience. It is intimate. You have to have an empathetic heart for the people that are experiencing these spaces, understanding that the staff is probably tired, and they really have to be on. The family may be grieving or celebrating a new life. Like, it's just every emotional view you kind of get into. And as the designer, I get to interview all of these people. I get to interview the physicians, the staff, and if I'm lucky, I also get to speak with patients and their family members to get, a very good perspective of what we're doing. In fact, I think we focus on the opposite of it. There's such focus on staying young and being healthy and are able-bodied and And there's less of an appreciation and sentiment toward what it means to have that wisdom of aging, and how we need to embrace that, and because we all do it, so like being able to focus on that and how design can support that, I think is an incredibly important part of interior design. My parents' generation, they're not going to be okay going into a senior center the way that we have historically placed our elderly. And so I'm excited to be on the other side and seeing how the progress is going toward that. The types of projects that I've worked on have ranged from, a small community space for a pediatric homeless population to a new hospital in China. I've really, I've seen a lot of different modalities, I guess, of healthcare, or lots of different environments of healthcare. And I think what's interesting is when you look at how society treats healthcare. And, when I'm doing a project in China and I have to be aware of how they treat healthcare and, their perspective on patients and how different it can be from how we do it in the United States. And if we're trying to, if the goal is to infuse an Americanized hospital into China, which this is a project I worked on with NBBJ while I was there, we really have to understand their cultural norms. I'm a trained postpartum doula. So I think that it has helped me be empathetic as a designer, to really gain perspective and have that kind of training that I've had. I'm also a mother, so I've had the experience in that way as well.